We start tonight as the fight against COVID-19 pandemic is continuing to evolve, but many across the country are struggling to find testing as COVID cases surge due to the Omicron variant. Deaconess confirming today that testing is up in its health system. But what about those home kits? Eyewitness News' Ryan Witry went in search of them. He joins us now with more. Ryan?
Over the weekend, Santa brought plenty of toys and gifts and even record high temperatures for the tri-state. But one thing many people didn't get in their stockings? At-home COVID-19 testing kits. In fact, this is only one of 2 home tests we're able to find across 5 different retailers. And the need for testing is at an all-time high, but kits like these are nearing a low. Now experts and lawmakers are trying to figure out their next steps.
You can't keep on hammering away at test, test, test if we don't have tests.
Across the country and across the tri-state, a good test is hard to find. And as the COVID-19 pandemic stretches into another year, President Biden told governors that the states will have to step up.
There is no federal solution. This gets solved at a state level.
IUPUI Assistant Professor Peter Fetterman says states have already been driving the local responses to the pandemic.
The reality on the ground that we have observed is that it is, in fact, state governments who are taking much or in some cases taking much of the control. In other cases, it is left to them and they do with it what they will.
And with Kentucky lawmakers preparing to return to Frankfort, State Senator Robbie Mills says he expects COVID and testing to be one of the priorities in the upcoming legislative session.
I think you're going to see probably more attempts from our part, from state government, to try to make rapid tests available.
But until then, what are people experiencing COVID symptoms supposed to do?
I would certainly try to get over-the-counter testing available, if not testing at one of the local hospital labs or clinics. If this is unavailable, then I would at least wait for a period of 5 to 7 days before returning back to your office or work, just to make sure that you have no active symptoms.
Despite the current testing issues, Dr. Schultz says there is room for optimism as we enter 2022 with vaccines widely available and the emergence of approved at-home treatments for the virus. Ryan Witry, Eyewitness News.